Good morning, everyone. And hey, Mark, thanks for joining us. My name is Frank Chistalki. I'm your VP of Intelligence with the Medical Alley Association, and I have the pleasure of leading our startup and our global work, of which this program is a part. I'm going to be joined today by some of our key partners from the Quebec government and in the work we're doing to promote trade and innovation between our two great clusters. And then by a fantastic speaker, Jeff Gravagna from Pointward Marketing, who's going to talk about U.S. go-to-market strategy and planning, specifically for healthcare startups. A couple of just housekeeping things. As we're going through the event, if you have a question anytime, don't wait till the end, put it in the Q&A. I'll be monitoring the questions and answers that come in, and then I'll bring them up to Jeff because we'll sometimes get repeat questions or maybe a question that we know is going to come up a bit later. So any questions you have, put them in there, and then I'll bring them up in the session. Second thing that I'll ask is, after we're done with this, if there's something that our groups can help you with, maybe you're looking at coming to the US, maybe you're looking at going to the Canadian market. We have great organizations here who are glad to help, glad to provide advice. Reach out to us and let us be of service to your organization. And so then before we get started, we've got a couple of people to make just brief remarks, our key partners in this. And so first I want to ask Dominic to say a few words. Dominic, if you would give us a quick introduction.
Thank you very much, Frank. Good morning, everyone. Bonjour tout le monde. Bienvenue à tous les participants québécois à cette activité. I'm Dominic Tétu. I'm Director of Economic Affairs at the Quebec Government Office in Chicago for Investissement Québec International. Our office in Chicago covers 12 states in the Midwest region, including the great state of Minnesota, obviously. We're part of a network of 35 offices around the world, and our main purpose is to support Quebec companies in their international growth. So it makes a lot of sense to us to be partnering with such a world-class organization as Medical Alley. We're very happy and proud to be able, once again this year, to support 10 companies that are taking part in this boot camp to grow their business and land successfully on the US market. I'm very happy also to see the global outreach of this initiative, as we have people from all across North America and beyond. So welcome to all of you, and make sure that if you're looking at developing business or partnership with Quebec, that you reach out to any of our offices around the world. Now, let me just finish by thanking our great partners, again, Medical Alley, but also Pointward with Jeff, and also Johnson & Johnson, who's sponsoring this initiative this year. So we're very happy also to have such a strategic partnership with Johnson & Johnson. And I'll get back to you, Frank, so you can show us a little message from Johnson & Johnson.
Thank you. I really appreciate that. And yeah, now we have a brief message from one of our key partners, Johnson & Johnson, who's helped to make this program possible. Give me just a moment to share the video.
Hello, everyone. My name is James Brody, and I'm the General Manager of Johnson & Johnson MedTech Canada. Bonjour à tous, je m'appelle James Brody et je suis le dirigeant de J&J MedTech Canada. Il me fait plaisir de vous accueillir aujourd'hui pour ce webinaire de l'initiative Québec Medical Alley. I am very pleased to welcome you today to this new webinar in the Quebec Medical Alley Initiative series. I'd like to thank Investment Quebec International and Medical Alley for partnering up to offer this fantastic program over 3 months to help medtech companies enter the US market. We applaud this initiative that recognizes the strength of Quebec health innovators and their companies. Your work ensures that health innovation and adoption remain high priorities in Quebec and across Canada, and that world-class companies in Quebec grow, thrive, and scale into the great life science companies of tomorrow. J&J MedTech is proud to work closely with health innovators in Quebec, supporting them to advance their innovation. J&J partners with innovators all over the province and the world to bring solutions for unmet medical need like robotic-assisted surgery and digital surgery ecosystems. In Canada, J&J MedTech always looks to collaborate with complementary partners in hospitals, health systems, and governments to solve the complex challenges of today, most notably surgical backlogs and a more efficient and patient-centric care pathway. We are keen to explore any such opportunities to partner on common goals, so let's keep in touch. Together, we will ensure that Quebec maintains a robust life sciences sector that is viable across the entire life cycle of a product, from innovation to adoption, to create the great companies of tomorrow. With that as framing, it's now my great pleasure to introduce to you another keen partner in this initiative, Jeff Gravagna, Chief Marketing Officer at Pointward. Pointward is a customer engagement agency for global medtech and healthcare brands based in Minneapolis. Its teams of medtech experts spans aortic repair to deep brain stimulation, from oncology to wound closure and beyond. And Jeff would like to talk to you today about US go-to-market strategy and planning, a great topic to cover for this audience. So Jeff, thanks for joining as a great partner. Take it away.
Well, and thank you. And folks, thanks for pointing out the first error that I had of the day. I appreciate it. We got that sound back. Jeff, over to you.
All right, that sounds good. And thank you very much for that kind introduction. And I will just take a moment here to share my screen. Bear with me. Okay. As mentioned, today's topic is go-to-market, and it is a wide-ranging topic. So as Frank mentioned earlier on, if you have questions or thoughts or would like to talk about more specific aspects, just let us know. I do have prepared remarks here, and this is a days and days long topic. So I picked out the highlights that I feel are the most exciting and basically the fundamental building blocks for go-to-market strategy. But again, would love to have questions come in. Obviously, I can't see all your faces. I love to do this live as well. But we'll make do with Zoom and we'll get started here. So again, just feel free to chime in with questions and thoughts as we go along. I have a particular point of view, and you're going to get a whole lot of that right now. So let me get, here we go. All right. So what is go-to-market strategy anyway? Again, it's a wide-ranging topic, but I just went to the Google, right, and just found a basic definition, just so we can all just ground ourselves. So again, this isn't me. This is basically the generic definition. But it's really important to understand that a go-to-market strategy isn't a written plan necessarily. It's more of a frame of mind. You have to have a plan to engage and deliver a value proposition to specific audiences. Now, that's the basic definition. But for MedTech, you need to think about this in a little more broad context. Because there's typically a mix of patients, providers, purchasers, and payers that make up your audiences. And so you want to make sure that as you're planning to launch your business or bring a new product to market, that you're really thinking about all of these aspects and which ones are relevant to you and which ones are not. And, I spent 20 years ago, I spent time on the client side. And I worked at Medtronic, and a lot of the times, even though we were very good at thinking through marketing and marketing strategies, sometimes we got really focused on just one audience. And so it's really important for you to broaden your thinking to make sure that you're including all of these different types of people as you start to think about your go-to-market strategy. So again, patients, providers, purchasers, and payers. So that's kind of the 4 Ps of go-to-market strategy. And it seems like there's always 4 Ps, right? Especially in the marketing world. So we'll focus on this, and just make no mistake, this is complex. It's complex in the fact that you have to think so broadly. And sometimes we get too much in our own function. And so I'm a marketer by trade. I'm a communications person by training. And so sometimes if you let yourself get too focused in your own area, you kind of miss the bigger picture. So the formula for success when you have a blank page, a lot like this when you're starting to think about your go-to-market strategy, is how do I gain alignment with a lot of the other functions that should be within your organization. And if you're a very small organization, you're probably filling several of these roles yourself. But again, you have to really think about, am I thinking about customers and patients? Some of you are going to have investors. So do I have their point of view in mind as well? If you're working on, and I'm from hardcore medical technology, so if you're working on a new device, what is engineering doing? How are they coming through their design and development process? And then am I going to be aligned with manufacturing if my product needs manufacturing? And then there's a huge component, obviously, in med tech, because it's highly regulated. So you've got your legal and regulatory partners that you have to be thinking about. And then how are you actually going to go to market? And that's your marketing strategy and your marketing team, and then also your sales teams. So it's so important to have all of these points of view in mind when you start. That's why I take a little moment here and talk about this word alignment. It is super critical to success as you start thinking about your go-to-market strategy. Because if at the end you're ready to launch and then suddenly you have, say, a clinical problem or a legal and regulatory problem, and it sets you back, it can delay your launch. And depending upon your product lines and the space that you're in, that could literally be millions of dollars a day of lost opportunity that you potentially will never get back. So as you go through this, make sure that you're really thinking broadly. So I'm not going to go through all of the bubbles that are going to come up on this mind map here. But again, this alignment concept is so critical. So how do I start thinking from day one about cross-functional strategy development? And so you need to start thinking about, where am I in my life cycle? If I'm still pre-market, what's my pre-market engagement strategy? And again, in medtech, which is highly regulated, you have to be very careful about how you do your pre-marketing or your pre-market engagement, I should say, because in some geographies, it's a little bit easier to talk about products that are still in development. In the United States, it's a little bit more difficult to talk about products until they have received market approval. So, but it starts with, but you have to be thinking about, how can I engage the market, and especially critical people in the industry, your audiences. There's a lot that you can and should be doing during this pre-market phase of your go-to-market planning. Then it really breaks down to, am I thinking about customer acquisition? How am I going to get my first customer? How am I going to get the next customer? And then what's the experience going to be as I bring them on board? And you need to think through the entire customer journey before you actually engage anybody. Because if you don't have a path forward from the moment that they become aware of your product to the moment that they try it, and then beyond even trying your product, like, how are you going to make them happy? How are you going to continue to encourage them to prefer your brand and keep buying your product or service? That's a super important consideration. And that flows right into your customer retention. And then you need to start thinking about, how am I going to be engaging the marketplace? And typically that's through some sort of a sales organization, or what is your sales strategy? Actually, if you go through a distributor, et cetera, you need to be thinking about, how am I going to align any activities that I'm doing with sales? And then also in medtech in particular, training and education is a huge consideration as you start thinking about your go-to-market, because a lot of these devices and technologies require specialized training. And so if you aren't thinking about that up front, you could get in trouble further down the line as you start rolling your product service out. And again, it's complex. So don't bother trying to read all of this. I'll leave it up long enough so that it's recorded so you all can take a look at it later. But you really do have to think about all of these different types of things, like how am I going to engage key opinion leaders? How am I going to engage hospital administrations if your product is going, needs approval by each and every hospital that it goes into? How am I going to engage physicians? How am I going to create my online presence? And how am I going to utilize social media and search and all of these kinds of things? Again, it's complex. It may seem overwhelming. And that's why this is a process that you have to understand should take you months. You need to spend a lot of time thinking about these considerations. One of the big mistakes that we see sometimes for those of us on the agency side is that sometimes our clients haven't even really scratched the surface on the thinking that they're going through and in considering all of these different aspects of go-to-market. So I'll keep rolling here, but again, you can always ask questions or you can send emails afterwards, and I'd be happy to go into more detail with you if that makes some sense or you have that interest. Now, with all of that being said, with that mind map, I want to give you a practical tool to kind of gather things together. If you're in this go-to-market planning mode, there's a simple tool out there that we subscribe to, and it's done by Strategizer. And it's called the Business Model Canvas. There's an entire book written around just this canvas, but this will help you think through all of the key things that you need to think about to set up your business for success. So you can see here, it's really starting to help you think about who are my key partners? What are the key things that we need to be doing? Who are the resources that I need to engage to be successful? And front and center, and very near and dear to those of us on the marketing side of things, value proposition. Have you really done a good job thinking through your value proposition? And I'll be getting into this topic in particular in more detail a little bit later in the presentation. And then also, how are you going to make what is your cost structure and those types of considerations? How are you going to distribute your product? What are the channels that you're going to be utilizing as you go to market? And I would encourage you to really take a moment and think through all of these different aspects. And again, an easy way to do this is just get a tool. Strategizer, again, is great for this. And I talked about the 4 Ps, right? In marketing, you've got price, product, place, promotion. You've got the 4 Ps on like payer, provider, blah, blah, blah. And if you can't remember all of that, think about go-to-market strategy in the most simple terms possible. What are the 5 basic questions? And have you answered them, and are you thinking about them? Who, what, when, where, why? And then the advanced questions are how and how much, right? So if you can just remember the basic questions and make sure that you're addressing all of them and really spending time to plan and collaborate with all of the different functional leads in your organization. Or if that happens to be you, you can have an interesting conversation with yourself. But do some thinking through this, but also engage with those people who are going to be in your audiences. And I'll be saying a lot more about that as well.
Hey, Jeff.
Yes.
We got a question from the audience that I think lines up with the business model canvas. The asker is asking about marketing directly to the healthcare organizations or finding a channel partner and how you might think about that.
Yeah, and that's a huge consideration. And that really depends on how are you going to set up your sales structure and your distribution models and things like that. So in the United States, it can be quite complex. And a lot of times there are buying organizations that you may need to engage with first to just even get on a contract. And then you also then need to consider, if you're on a contract, that doesn't necessarily mean you're going to have instant adoption within any specific account or hospital. So you will have to do potentially some direct engagement with each individual institution as well. It really depends upon each and every hospital and the system that they're a part of, and then if they're involved in GPOs or group purchasing organizations, and that's a big thing in the United States. A very large percentage of sales for medical technology goes through these organizations. I think I've heard the figure 75 to 80% of those types of purchases go through GPOs. So that's something to also consider. And it takes a lot of research. And I would encourage you to reach out to organizations that really understand the medical technology space, because they can help you to understand, especially if you're just coming to the United States markets. I hope that answered the question. If not, feel free to re-ask as we kind of go through this.
Thank you.
Yep. And as getting back to the business model canvas, and what was front and center there is the value proposition. So I put this up front because it is so fundamental to success for whatever your product, service, or technology might be, that it needs to be mentioned and discussed up front. So and this is also in Strategizer, by the way, and there's an entire book just around building value propositions as well. And we'll talk about it here for a little bit, but I cannot stress the importance of this. And I want to give you some practical things that you can really that you can bite off and chew. And so I would encourage you to go and get some of these tools. And if you haven't thought through this in a very detailed way, I encourage you to do it right now. Like the next activity that is not urgent and important on your plate, you should make this at least an important idea that you need to sit down and spend some time with. So a lot of times in medtech, we see brilliant people coming up with brilliant ideas. They have great ideas for new technologies, new procedures, new devices. So they tend to start on the left side of this map, which is the product or service side, right? Where they should be thinking from day one is really starting with who are the audiences, and that's the right side, and really thinking about every person that's going to be in your ecosystem that your product or service is going to touch or have an impact on. In the case of patients, what is their perception and what do they think in your space or about therapies that you're seeking to either introduce in which case you're going to be trying to replace an incumbent. We'll talk a lot more about changing people's minds here in a bit. So you're either going to be replacing that, or you're going to be trying to say, I'm better, or I have some other reason that you should use my service or product instead of another. And so on the right, please start thinking from the customer or the audience point of view. And I'll spend a little bit more time with this map a little bit later. But again, if you haven't really started thinking about the audiences, I would encourage you to grab a book from Strategizer and start thinking about value propositions, because it's so critical and fundamental to success. I'll pause here just to grab any questions on value proposition, and I will go into more detail on this, but any questions about my opening comments or remarks?
No questions at the moment.
Okay. So let's go into some of the building blocks as you start to think about your go-to-market strategy. And let's really think about what do we want to do. And let's start thinking about, let's begin with the end in mind. And it all comes down to, at some point, you are going to introduce your product, your service to a marketplace. And it all starts with a sales cycle. And we get a ton of questions about the sales cycle. What should my sales strategy be? And again, it comes down to cross-functional thinking here. So let me just go through the basic sales cycle. You have some audience out there that you want to reach. And eventually you will need to get paid for this service, product, or whatever. So you need to really understand, who do I need to target? Then it moves to qualify. So once you target somebody, then you have to understand, do they have a need? Do they have money? Do they have a desire? You have to qualify them, and that'll drop out a certain percentage of people that are going to be in your broader total accessible market. Then you're going to engage with them. And I'll keep going here around the circle, and we'll talk a little bit more about the functions. But you need to engage with them in some way. And then eventually you're going to have to get them to the point where they say, yes, I'd like to try your product, or yes, I'd like to buy more of your service. And then you're going to have to service them and move them back around through the cycle, hopefully into repeat sales. So that's how the basic sales cycle works. And you start with 100% of your market. And marketing's job is to really understand who of the people out there you should be looking to target, and then figuring out how to reach them. And then once marketing engages with people, they have to pass it off somewhere to the qualification phase to find out who's really serious, who has the budget. That's typically the sales function. Sales takes them from qualification to engaging them, and stays engaged all the way around to close. But really, sales needs a team once they kind of figure out who is qualified, to really engage with them, potentially educate your audiences as to why they should use your product or service, et cetera, et cetera. So that's typically training, education. It could be more technical people, trainers, et cetera, et cetera. And then, oops, hit the wrong key. Sorry about that. Then it becomes training, education, customer service, making sure that the customer is happy, has product, the service is working well, et cetera, et cetera, et cetera. What's interesting about all of this is you start with 100%, right? And each phase you go through, people drop out. So you start with 100%, you're targeting 100%, and say you have 50% left by the time they're qualified. Then by the time you go through engage to close, you've lost another 25%. And the reality is that typical success rates for sales are 3 to 5% close rates. this is not easy to do. So the goal here isn't to close 50% of the market. That's unrealistic. Your job really is, especially when you're a new brand or a new technology and you're just trying to get going, you're going to have to realize that typically you're at a 95 to 97% failure rate, and that's okay. Your goal is to be incrementally better. And if you're even just incrementally better in the right markets, that can mean millions and millions of dollars. But you should have very clear expectations, especially when you're going into a market where you're not a market leader, you don't have the brand power and things like that. So I think that's potentially really relevant to an audience like this, especially if you're bringing new technologies to market. So there really are three key questions. And the joke here is, which one is most important? What we say, how we say it, or when we say it? And it's really a trick question because they're all important. They're all equally important. So as you start thinking about your go-to-market strategy, you have to understand that there are basic truths out there. And maybe there are different models that you've seen, and maybe these models have evolved, but sometimes you just have to go back and stick with and realize that the classics are true. And people put spins on these things. We put spins on these things here at our organization as well. But there are a couple of just fundamental truths about go-to-market, and especially if you're a brand new technology. So you're always going to have people out there in your audience that are going to be innovators, early adopters. You're going to have the early majority, late majority, and laggards. Your job is to get into the early majority because that's where most of the money is made. Late majority and laggards, they're nice to have, but if you can get across the chasm there, and I'll say a little bit more about that in a moment, and get to early majority, you will have been successful because that's where the vast amount of your money will be made. The problem is getting there, right? So on top is something called the hype cycle. We all go through it. You just have to understand that as a new company bringing out a new innovation, people are going to see your technology, and innovators are going to go, "Oh my God, that sounds amazing." And they're going to have some sort of a trigger that's going to get them super excited. And they're going to be all in with you. And they're going to be like, "This is awesome. Show me more. Let's go here." And then they're going to get to this peak of inflated expectation. And they're going to start working with it. And then they're going to say, "Oh, but this doesn't work quite the way that I like it." And then they're going to go down into the trough of disillusionment. And they're going to start questioning, well, is this really that much better? Or, man, this is a really tough transition to make as far as the procedure is concerned. But that's where training and education and those kinds of things come in. And then you need to guide them up the slope of enlightenment to where then they become consciously competent in using your technology. And then they get into this plateau of productivity. So the goal of your go-to-market strategy is to compress the peak of inflated expectation and the trough of disillusionment into the tiniest sliver that you possibly can, so that you catch them quickly and start bringing them up the slope of enlightenment. And that will help you with what's on the bottom. I'm sure you all have seen this model. It's from Jeffrey Moore and the book Crossing the Chasm. The chasm is where great technologies with poor plans go to die. So innovators, they'll get excited about anything, but it's a very, very small percentage of the population, but you need them. They're the ones that you need to work with to refine your technology or your process or whatever it may be that you're bringing to market. And you want to get them excited. And then you want to get to some of the early adopters to help you to continue to build your technology or service again out. But if you're not careful, you will fall into the chasm and your product will not make it. It could be you run up against a big competitor that comes after you full bore. They bring a lot of money against you, or you're not prepared to deal with things like compelling clinical evidence. You don't have good customer service, et cetera, et cetera. And that's where the danger is with any new technology, especially if you're a startup without brand power, et cetera, et cetera. If you can jump the chasm and get to that early majority, that's where your money is going to be made, and then you will be more successful. So that's the first set of models to consider. How am I going to achieve this, right? Then you also need to start thinking about, and remember those questions I said to think about, the basic ones. Don't worry about price, product, place, promotion, provider, payer, blah, blah, blah. Think about who. Think about who. So when you're going to an audience, you need to think about what are the types of people that I'm going to be encountering, and are they data driven? Are you going after a surgeon? Are they going to want to see pretty serious clinical evidence? And the more invasive the technology, the more evidence they're going to want to see. Or are you going after C-suite, which would be in the upper right-hand corner? Are you offering certain types of advantages around cost, et cetera, et cetera? But you've also got to think about all the different personality types. You've got to think about those people who are more intuitive. Sometimes some of those early adopters fall into that category. And then you also need to think about people who are more introverted and more on the social side of things, especially if you are going toward patients, if you're going toward audiences like that. Caregivers are important. So you really need to think through who you need to be talking to and what the messaging needs to be to appeal to all of these different types of people. And we all have pieces of all of these in our personalities. We tend to favor certain ones based upon our own genetic makeup and et cetera, et cetera. But you do need to understand that you need to think about the messages that you need to be giving to each of these types of personalities as well. And then when we say it, at our company, this model here, it seems super simple, and it's certainly not a new model. This is age old, right? This is our spin on it, but awareness to advocacy. You have to be thinking about, from the moment that I make somebody aware, how am I going to educate them as to why it's of benefit to them? How am I going to get them to try my product, and what is that experience going to look and feel like? And then how do I get them to go beyond the first trial? If they have a terrible experience and I'm not ready and I'm not prepared to make sure that they have success from day one, I could be in trouble right at trial. So I've got to think through, how do I train them? How do I make sure they have, if it's a complicated procedure, it could take 15, 20, 100. It depends on the whatever it is. But how many times do they need to use it, where I need to hold their hand or be instantly available until they become comfortable and satisfied? And then what am I doing around the extra services or things like that I'm providing that really bring people back to me? And then how do and here's the most, especially in today's world of social media and things like that, how do I get them to advocate for me and say, you got to use blank, right? So this is how we think about, in a nutshell, our go-to-market strategy. It always comes back to this And we're always thinking about, I'm either in an acquisition mode with somebody who I'm just making aware, or I'm trying to bring through that education cycle. And we like to break education down into comprehension and believability because those are two separate things from our perspective. One is more technical and then one is more emotional. Or we're trying to retain a customer that I have successfully closed. And now I'm trying to figure out, how do I make this as easy for them to continue to do business with me as possible, and then get them to tell all their friends. And depending upon, again, your particular product or service, your audience could be very, very small. Certain types of, if you're going after surgeons, for example, there may be 6,000 of the people that you're going after that will actually put your product into a human being for delivering some sort of a therapy. So you have to really understand the size of your audience and the importance of your audience, but then you also have to understand the patient side of things as well. And then how do you also get potentially even patients if it's a more commercial oriented product or service you have? How do you get them to tell their friends too? So I will say just a couple more words here. There are a few areas where you can fall down. You can get somebody and make them aware and get them excited. And remember, we talked about that hype cycle. But if you don't grab them and really walk them through, like, how do I use it technically, but also, will it help me make money? Will it relieve my pain? Will it be easier for me to use? Will it bring me more efficiency in my practice? And you can see I'm jumping audiences with potential little questions, that might be popping off of any one of these particular audiences' heads. Do they really believe at the end of the day that spending money with you or using your product will give them better patient outcomes, or that it will bring some other sort of benefit to them? And you have to get through that believability gap to get them to trial. And then there's also, once you get them to trial, you may think, this is great. I've got, 5,000 out of 6,000 people have tried my product. But then you may find that your market share doesn't reflect that, and you have to ask yourself, why is that? And we like to split up the right side of the continuum between adoption and satisfaction, because those two things are very different. If you get somebody to try your product, it doesn't mean that they're going to necessarily adopt it. And if it feels like they've adopted it, it doesn't mean they're going to be happy with it. So I used to be a product manager. And so the way I tell this story is that in the particular industry that I was in cardiac rhythm. There were often three major players. And I could be in a three-way contract in a hospital with the three major players. And it could be a 33% split on the contract. So as a product manager, I'm thinking, I've got 33% adoption. I could have 0 or 100% satisfaction. If people loved my product, it was a great day every Wednesday when the 33% of my product was used for these procedures. It could be a really bad day when it was my turn and nobody liked my product. Because then it was like, oh, it's the terrible day when I hate using this product, et cetera, et cetera. So the idea here is to understand the difference. You may be on a 50% contract and you think you're going great guns, and you could have 0% satisfaction. And when that contract comes up in 2-4 years, whatever your period is, you could go to 0 really fast. So that is a little bit around what I consider to be the most important. Again, this is an in-depth topic, but I'll pause there to gather in any questions, thoughts, or comments at this point.
There was a question that I think your crossing the chasm stuff answered quite a bit, but you may want to give a finer point. Person had asked for like a new medical device. What might you recommend as far as building like client use cases to build up credibility?
Build up client. So I
think
love
like establish brand.
So the answer, my gut shot is absolutely. Case studies are a fantastic idea. And I may actually, I'll just keep that question in mind as we go through, because as you start building out your business matrix, which is the next step in really starting to assemble your go-to-market plan, I think that will come up. But building case studies, absolutely critical. There's a clinical, potentially a clinical component built into this too. Like, how do you actually build those case studies when the product isn't approved? So you should be building that into your clinical study plan as well. But let me maybe keep that in mind, and I'll hit that as we go forward. Okay. Let's get down into some practical things that you all can use. And again, go back to the recording and take a look at these models. Just be aware that these tools, if not used properly, they have warnings that come with them, right? You should really take time with that business canvas and also with thinking through these questions. It looks like a simple 5x4 matrix. I literally watched a consultant take the business canvas, stick it up on a wall, and we were watching in horror as this took place. And they literally wrote 2 words in each box in like 15 minutes and said, "That was easy." It was tragic. It was so shallow in its thinking, and we immediately said, no, that you really aren't getting the concept here. And so we had a bigger discussion after that. But a good way to start setting up for doing that business canvas is to really sit down and think about, who are my customers or the audiences that I want to talk about or talk to? Who are my competitors? What does my space look like? And competitors can be literally other companies that you are thinking you will have to compete against, but it could also be things like lack of use. It could be lack of awareness. So you've got to think about that too. Like, what is the current standard of care if you're trying to introduce a new therapy, or if it's a technology or something, what currently fills that need or gap, or what is the problem that you're trying to solve? So identifying needs, right? But you also have to take a step back and think about, what are my corporate, what's my corporate perspective? And then we often do this from a marketing perspective. So we also need to think about the marketing. And since this falls within go-to-market strategy, it probably is appropriate to have marketing there. And then that last column on the right used to be just sales. But honestly, it's broader than that. So I'm going to eat my own cooking. So it needs to be broader than just sales. It can be training. It can be anybody that is directly contacting an important audience for you. And what is their perspective? And a lot of time we see, and the reason marketing and engagement / sales are right next to each other is we actually see battles between these 2 functions going on with both huge organizations and small organizations. Because salespeople think that it's just their job to sell, and they don't need to be aligned with marketing, messaging, positioning, all of that kind of thing. They just need to move the dollars. In one way, that's true, but you also need to be aligned to bring maximum effect and maximum impact on the market. You need to have marketing and sales saying and acting in the same way to help build your brand. And then down the left side, you need to understand, what are the current beliefs of all of these different types of people, especially the customers and competitors. What are their beliefs? So that's what's in their brain today. what are the boundaries? What are the boundaries you're going to face? What are your opportunities? And then what are you going to measure? Because you really have to think about measurement from day one. So it's a little bit of a modification of a SWOT model if you really think about it. But this is a session that we run for a lot of our clients. It looks easy. This is hard to do in even 2.5 to 3 days once you get in. And it really is impactful as well. We one time had a CEO coming out with a new therapy for cancer, and we talked to him, and he believes in all of this. And he's like, we just aren't aligned. We haven't really thought through this. We need to take a step back. Can you guys facilitate this for us? And we said, yep, here's our plan. And he brought in the founder. And the founder of the company, brilliant person behind the technology for this particular cancer therapy. And he sat in this meeting, and he was a little standoffish at the beginning. And then this guy got into it. And at the end, 2.5 exhausting days later, he goes, and he talked to the CEO, when you invited me to this, I thought this was going to be some marketing, pick your favorite expletive in whatever language you choose. And he said, but you know what? This was really the best thing that I think we've really ever done, because it really brings into focus what we're trying to do, with whom, et cetera, et cetera. So the power of this, it may seem like a simple 5x4, but the thinking and the conversation that you have with a cross-functional team, and that was also something critical about this session, is we had legal, we had clinical, we had human resources, we had engineering, all in the same room, and they all had shockingly different opinions and thoughts around the same technology that they're trying to develop. And so again, back to alignment, simple concepts, hard to do, but you've just got to keep in mind, am I aligned? Are all of my players aligned? And are we all moving in lockstep? Once you kind of have some of that done, here's another critical building block that you need right up front. You really need, yep.
There was a question, and this part may be answering it. They're just asking, where might you document needs, problems on that business matrix, or is that done somewhere else?
Needs and problems, I think, is part of that upstream process that is so important. Identifying needs in the marketplace. It certainly should come out in your product development process, but I would say start addressing that in your value propositions. Like, what problem am I solving? What are the needs of, I'll just use a surgeon because that's the one I'm the most used to. What are the surgeons, what needs do they have on a daily basis, and how am I going to solve them? What are the jobs that they're doing? And I would love to, and I know I'm running a little long here, and I've only got a few minutes, but I have a lot of thoughts on value proposition as well. I hope that answered the question, but if not, at the Q&A here, I'll speak for just 3 more minutes, but then I'll just open it up and then we can wrap from there. I just want to get through a couple more tools. The marketing claims matrix. This seems pretty straightforward. A lot of companies think about this as their clinical claims matrix. As a marketer, I would encourage you to talk with your clinical claims people and engage together on a marketing claims matrix, because if clinical starts to take control of this and starts to be in charge of the claims that you're going to make out in the marketplace, that can lead you down a pretty rough road. We've seen so many of our clients try to come to market with claims of safe and effective. And then as a marketer, you're sitting there saying, and so you really need to think about what is going to make you different. And that comes out in this marketing claims matrix. Marketing's job is to figure out how to position your product, how to find a way to make you stand out in a crowd, and then how am I going to prove anything that I want to say? In the United States, if you want to make specific claims like it's better than blank, you better have clinical evidence so that you can actually say it. And if that's the key to your success going into the market, you better have it in your clinical plan, which leads right into the next tool is how does your clinical claims matrix then line up with your clinical strategy? You're going to need your regulatory and clinical, right? Your regulatory strategy, you're going to need data. You're going to need to prove safe and effective. You're going to need to prove your endpoints, blah, blah, blah. But will it help you differentiate? So where are those critical claims and how are they built into your clinical strategy? So this is another concept that hopefully you all have if you're working on a therapy or a device. It's critical to have that and way up front. Don't wait till the end to bring marketing in and hand them safe and effective because they will not be happy people. I can tell you that. So I'm going to pause there. The rest of the information that I have, and I'd be happy to come back at some point in the future, but it really delves into more what do you do around specific, how do you identify specific audiences? How do you tease out information? How do you position your products? Like I said, this is a days-long topic, but at least we were able to get through some of the building blocks. And I'll pause there and see if there are any final questions that or comments that people would have.
Thank you, Jeff. Really appreciate that. Yeah, there was a question from the audience. They were asking if you could comment on using these tools and dealing with value analysis teams in hospitals.
So using this process is critical for those value teams. And one of the key ways that you can figure out, and this actually belongs in this audience identification and segmentation and positioning piece of this that comes after, it's what's important to them. And do you have voice of customer from those types of people? Like, do you understand all of the considerations that each one of those committees, what they use, what are their criteria? And another thing that makes that question really intriguing is that it's a daunting task. Each hospital or hospital system tends to have their own committees that may think nothing like the hospital or the system right down the street. So that's where that cross-functional collaboration with your sales team. If you're a larger organization, you might have a corporate accounts team that deals with more of the economic buyer. So those are all things that you need to think about, like who's actually going to write the check? Who's actually going to approve my product for use within a hospital if now I'm on contract through a GP? Like I said, it's complex and it's all custom to your situation and your market and who your audiences are. So hopefully you can use these tools to think through all of that. And if you can get it on your business canvas, and if you can get a good value proposition for each one of those audiences that pops up on your business canvas, you're going to be worlds ahead of so many other companies out there, even if you just get these basics documented. But I didn't get to my favorite topic, which is positioning, key messaging, and all of that. But again, happy to do that at another time. Any other questions, comments, thoughts? Sorry, I went. This time flew by. So.
Thank you. We got one more question that came in, although it might not be a fit for this because they're asking about clinical trials. So Uzma, if this question, I think isn't a fit, yeah, clinical trials question, maybe not right here. So Uzma, if you want to email us, I can connect you with someone who can answer that one. Not seeing any other questions, although we got our friend Ron Von Wald said, excellent presentation and thank you.
Oh, well, thank you. Thank you, everyone. I appreciate
Yeah.
your attention and coming to this.
Well, folks, if there are no other questions, we'll let you take a few minutes back. So let me just pop back on camera for a moment. Folks, thank you so much for joining us today. Jeff, thank you again for sharing your great perspective, your great knowledge. It is always helpful. And for those who are wondering, right, we did record this webinar. You'll get a copy of it afterwards so that you can review. And if you have further questions, reach out to us. We're happy to connect you with Jeff. Pointward does fantastic work. So if you need help, like, this is a really good group to reach out to. All right, and with that, folks, I'll say thank you and have a great rest of your day.